Hello, and welcome to this week's podcast. This one's going to run a little bit longer than I normally do, but there's just no way to avoid that. There's just a little bit too much information to squeeze in and do it justice if I limit it to my normal hour. So we might run a bit over. You can always stop it and start it back up again. But I felt like this is not a subject you take on without giving it the time necessary to cover it. So this is More Than Life, More Than Myself, Part 3. Trans Surgeries on Minors. Today's topic, like the rest of this series, relates to the issues we face with our children. The things I say in this article will be things I stand by as relates to children. Adults are a separate matter, one that perhaps needs to be addressed at some point, but is not one that I'm addressing here today. There has been scandal after scandal in this field. We've been lied to about everything from exactly what is and isn't being done, at what age, under what circumstances, and even what the data actually says about the success rates for these kinds of treatments. But the most disturbing part of all of this is what they actually do in these surgeries, and what the patients have to live with permanently after that. I don't enjoy graphic topics, but this is one instance where it is simply unavoidable. People need to know exactly what the discussion is about in order to know where they want to stand regarding it. But that also means this podcast is not necessarily for children. We were told that these surgeries were the only way to prevent young people with gender dysphoria, who identify as trans, from committing suicide, that these surgeries were life-saving. The studies simply don't back that up. In fact, they show some to the opposite effect. Trans people are actually at their highest risk for suicide within the first 10 years after their final transition surgery. Whether that is because doctors overpromised on what they could deliver and there is nothing left to try to give them a sense of hope in continuing to go forward, or whether it's because the outer surgery didn't fix the inner turmoil, or for another reason, there is really no way to claim that these surgeries are life-saving based on a study to back that up. The stats just don't show that. There have been many scandals with the Tavistock Clinic in London and multiple children's hospitals here in the USA that lied about what types of treatments they were providing to minors and have been caught out in those lies. There were lies about the extent of any counseling that children had received beforehand or any pre-screening for other conditions that might explain their dysphoria without having to address it through radically invasive surgery. Many of the children at Tavistock Clinic had other issues that were not addressed at all, such as autism. Long-term studies also show that when gender confusion occurs in children, if you merely allow them to go through the natural awkwardness of puberty and don't make things worse by over-focusing on it, in well over 80% of cases, the gender dysphoria will resolve itself by the age of 19. These studies also show that in most cases, the child was actually gay and struggling with not wanting to be homosexual. In their mind, if they could become the opposite sex, then their being attracted to the same sex that they are biologically would make them straight because they aren't the same sex as that person anymore. Chloe Cole is a detransitioner. Many of the other examples I will give are not. They still identify as trans, but she doesn't. She started her transition at 12 years old, followed by puberty blockers and testosterone at 13, and a double mastectomy at just 15 years old. She stopped transitioning at the age of 16 and now looks back on the whole thing as a terrible mistake. Chloe started puberty early, at about the age of 9. This began a very difficult time for her, as it does for most children, especially girls. Before puberty, children of both sexes experience about the same level of negative emotions. But with the onset of puberty, the level of negative emotions, anxiety, emotional pain, frustration, disappointment, shame, guilt, and self-consciousness goes up dramatically in girls and remains higher than their male counterparts for the rest of their lives. Women are much more likely to suffer from anxiety or depression than men are, between 3 to 5 times as likely depending on which culture you're studying, but it's true across all of them. During puberty, self-consciousness and body shame often become the primary focus of these negative emotions in girls. Chloe had grown up, like many girls, with a tomboyish personality, and it wasn't until she reached adulthood that she was diagnosed as being on the spectrum for autism. She had always gotten along better with the boys than with girls, and when she hit puberty early and shot up, that increased. But it made it easier for her to keep up with the boys, in which she took great pride. But when the boys eventually hit puberty too and outstripped her in height and strength and speed, this brought on a lot of distress and a feeling of having no place to fit in anymore. She didn't really fit in with the girls, and now she was no longer one of the boys. This caused a lot of loneliness. As a young girl, Chloe had actually looked forward to puberty. She saw the beautiful women that were celebrities and looked forward to developing a woman's body with Kardashian-like curves. She was too young to know that even the Kardashians don't look like the Kardashians without help. But when she developed, like many girls, myself included, she was disappointed. She was skinny, with a small chest, and did not look like she had pictured at all. Simply put, she just didn't feel that she would make a very good woman. She didn't feel pretty, and believed she would never compete well at being valued as an attractive woman. There actually are some good long-term studies on children with gender dysphoria available. Some of the best were conducted by Kenneth Zucker in Toronto. He is a psychologist and a sexologist and was entirely apolitical with no horse in the race. And his clinic produced many quality, peer-reviewed studies. What those studies showed was that true gender dysphoria was very rare. But even so, if you leave children alone until they are 18 or 19, 80 to 90% of them come to embrace their biological sex entirely on their own, sparing them the horrors of the surgeries that we will get into later. So 8 or 9 out of every 10 children with gender dysphoria will happily settle into their identity if allowed to work through it during their teen years without being put on the path to transitioning. Out of those 8 or 9 children, 80% of them discover that they are really gay and come to accept that. So based on this study, if you have a child who has a gender non-conforming personality, what we used to call being a tomboy or a, quote, soft boy, and with the onset of puberty, that gets combined with depression or anxiety, it can set off a feeling of gender dysphoria. But if the parents and the therapist simply back off and don't put ideas in the child's head or try to make a bunch of permanent decisions, you have an 80 to 90% chance that that child will grow into a normal, functioning adult who is glad that they didn't transition. So the odds are in your favor, not foolproof, but in your favor to take that approach. Ken Zucker's findings were not acceptable politically, although they were very well researched and backed up. So he was pilloried and fired. He recently won a lawsuit over his mistreatment and has been vindicated. He actually followed the tenets that all doctors swear to, but many are not living up to first do no harm. These kids need support and to be assisted in mentally working through their problems and their options. But the odds are against you if you decide to pursue a more aggressive and permanent approach at that age. Chloe is very creative and always has been. She was especially drawn to an image-based platform like Instagram. Instagram, however, only made her feel worse about her own body, however. This was compounded by the fact that once the girls her age hit puberty as well, they began to outstrip her in the voluptuous curves factor. All of this was compounded further by the fact that the women in her family gave her a very negative impression of womanhood. They were always complaining about how horrible puberty was for girls, what a nuisance dealing with your period was, how scary it was to be pregnant, how excruciating it was to give birth, the world's expectations on you as a woman, then to age in a world that judges women on their looks, only to go through menopause. Only the negative sides to being a woman were presented, never the benefits or the things that are enjoyable and empowering about it. It was at this same time that the online world introduced her to feminism, so she heard further complaints about how all women lived oppressed lives under the thumb of the patriarchy, who controlled them and took away their rights as human beings. Is it really surprising that Chloe wanted nothing to do with becoming a woman? Why would she? Under this influence, and at such a young age, Chloe didn't believe that she would ever want to have children or anything to do with a woman's life. But since detransitioning, and as she has outgrown some of her childish preconceptions, she now has a deep desire to be a mother. People change, especially kids. As a teenager, she was trying to live the life of a boy, and she was taking testosterone. She had been viewing a lot of LGBT content, where she saw a lot of trans and non-binary people who always explained any feelings of not feeling like you fit in as evidence that you are the same as them, as though feeling like you don't fit in anywhere and are uncomfortable in your own skin is not something that absolutely every teenager goes through, although some obviously have it worse than others. She saw the attention and especially the emotional support these transitioners were getting online. She envied their sense of community and how so many people had their backs, and she wanted all of that in her own lonely and confused life. To her, it seemed like these people online were describing the same things she was going through. And when they came out, they had all this support and belonging. Plus, they were offering her a way out. It turned out she didn't have to be a woman just because she was born one. After experimenting for a few months with her gender identity and her sexual identity, she eventually decided that she was trans and began coming out to a few friends and siblings. A few months later, she wrote her parents a letter as her way of coming out to them because she wanted to pursue medically transitioning. She wanted them to refer to her as their son, to call her by a new name, and help her transition into a boy. They wanted to support her, but they were understandably caught off guard and uncertain about what was the best thing to do for her. They decided to turn to an expert and sent Chloe to a therapist. In the past, a therapist's job was not to affirm their patients no matter what issue they brought them. It was their job to listen for dozens of hours and help their patient work through whatever they were going through in the healthiest way. Sometimes that might involve affirming them, sometimes not. But that is supposed to be evaluated on a case-by-case basis. If a man goes to a therapist and says that he has anger issues that are destroying his relationships and he worries about becoming abusive, it is not the therapist's job to affirm his self-identity as an abuser. It's the therapist's job to uncover if he is actually abusive and help him work through whatever problems they uncover that are causing that. The idea is to allow the patient to explore their issues thoroughly in order to decide how to proceed, which is why laws that now require therapists to ignore their professional training and immediately affirm gender ideology with no exploration is a very dangerous restriction on a very important profession. None of these things were explored during Chloe's sessions with therapists. She said she was a boy, they affirmed it, and they weren't really interested in exploring further. Even Chloe was very dissatisfied with their lack of knowledge or assistance. She told her parents that she wanted to start hormones. They hesitated. She was only 13, and they wanted her to wait. They didn't say no, they wanted her to wait. But when Chloe received her official gender dysphoria diagnosis, the professionals didn't even present it as though this was a choice. This was simply what you did. You transitioned. They told her parents that there was only a 2% regret rate with transitioning, which is not true. And they guilted the parents with the threat that Chloe would be at a very high risk for suicide if they did not allow her to medically transition immediately. The now famous club of "Would you rather have a dead daughter or a living son?" was used. Faced with that horrifyingly manipulative threat, Chloe's parents were coerced into allowing her to see an endocrinologist. The first endocrinologist actually did push back and said that at 13, she was too young for cross-sex hormones. The things she wanted would have permanent impacts on her brain development, and they refused to prescribe her the drugs. But she was merely sent to another endocrinologist who saw her a couple of times and then started her on puberty blockers and then on testosterone shortly after that. Chloe had to sign the forms first that went over the potential side effects, but she was a child. And a child who had always been healthy, who thought that nothing bad would ever happen to her. So she didn't hesitate. Once she started the testosterone, her hair started growing in thicker, she started to put on muscle, her face became more squared off, as did her body, and she felt like she made a better boy than she had made a girl. She felt like she was in control of her life for the first time. Plus, testosterone has a known euphoric effect. So things seemed to be heading in the right direction as far as she was concerned. She thought she was going to become her real self, that she was on the path to becoming a whole person. But the long-term results was that it only fractured her sense of self even further, and her life became much more complicated. She was still primarily attracted to boys, but the few boys that were attracted to her, as a girl who was transitioning into a boy, were not guys that she was interested in because the whole thing seemed to be mostly a fetish for them. And looking back on it, Chloe does believe that there was an element in her desire to transition that was more autogonophilia in nature. Just to briefly explain that, there are 3 major categories of people that get put under the umbrella of trans. The first category would be intersex. These are people that are born with a genetic anomaly that makes it hard to determine if they are actually male or female. Sometimes they have genitalia that's deformed or can have the appearance of both, and so it can take some time to figure out if someone who is intersex is actually male or female, and they require surgeries a lot of times to repair that, to make their body match their genetics. Then there is gender dysphoria. This is somebody that is completely in every single way either male or female, but has the mental feeling that their personality is such that their personality is more the opposite sex and that they're in the wrong body. It's a kind of body dysmorphia, like when anorexics look in the mirror and they see a fat person, even though they're skin and bones. This is the same thing. A person with gender dysphoria looks in the mirror, they see that they should be the opposite sex. They have this disconnect between their mind and their body, and it causes them a lot of distress. And then the last category is autogynephilia, and that is what used to be called transvestites. It usually affects men, but it can affect women too. It is where a person gets a sexual thrill by picturing themselves as the opposite sex. It's not that they really believe they are that opposite sex. It's that they get a little bit of a kinky, for lack of a better word, thrill out of picturing themselves that way, or dressing that way, or behaving in that way. So that hopefully that makes sense to everybody. Because of the testosterone, she began experiencing more confidence and competitiveness, and also a much stronger libido, which led her to become addicted to pornography. She was watching all of her peers become involved in relationships, but her options were extremely limited in both who she was attracted to and who was attracted to her. This caused her to grow even more depressed. She turned to online relationships, which left her unsatisfied and often feeling used, and the depression spiral continued. After about a year on testosterone, she developed worsening anxiety issues as well, and severe UTIs. It was at this point that she was sexually assaulted when a boy in school groped her in a classroom. This directly led to her deciding to start binding her chest, and she had her mom buy her a chest binder online. It was very restrictive and uncomfortable, as well as hot, so it only increased her desire to be done with it and have a mastectomy. So her gender specialist referred her to a surgeon despite her age, and once again, with no hesitation or exploration first. And this was despite the fact that she had been officially diagnosed with depression and an anxiety disorder by this point. It was not until this point that she first experienced thoughts about suicide, well into the transition process, and she was not responding well to the antidepressant that they had prescribed for her. It actually made her worse. Chloe and her parents went to a class at the hospital on top surgery, where the other potential patients were even younger than Chloe, who was only 15 at the time. Chloe's body's issues had only grown worse. She liked the masculine changes to her body, but she was increasingly fractured over the fact that these changes were still occurring to a female body. There was an ever-present contradiction that confronted her hourly. The binder had also destroyed the shape of her breasts, and there was a part of her that felt that there was no going back. So she simply wanted to be rid of them. The doctor asked her if she was aware of the fact that she would lose the ability to breastfeed, but just like when they asked her if she was aware of the fact that she would experience vaginal atrophy when she started testosterone, at 15 she didn't care. And at the end of this, she was going to be a man, so men don't breastfeed. She didn't think she wanted kids. She wasn't sexually active. She didn't understand the consequences of any of this, although she nodded and signed all the paperwork. How could she understand any of this at 15? And that's the entire point. Her recovery took months. She didn't have much range of motion and couldn't lift her arms above her head during that time. Her mom had to take off work to help her. But when they removed her stitches a week later and she saw her massively scarred chest for the first time and the trenches of the deep scrapes they had carved in order to reposition her nipples in a more masculine place, quote, "It's barbaric, to say the very least," she says. And when I took the dressings off, when I looked down, the grafts, they were black. Because during the surgery, the blood supply was cut off, and so the outer layer of skin had died. And they said that that was how it was supposed to be, and that was just part of the process. But I couldn't bear to see that part of my body." End quote. But she had to look at it every day when she changed her bandages and when she showered. There was no escaping what she had done, and to this day, she doesn't have normal sensation in the grafts. She says she can touch certain parts of her chest where they rewired the nerves, and it feels like she's touching a part of her arm. Only a couple of months later, her regrets multiplied. She started to miss having softer features and a more feminine body. She had been on testosterone for 3 years and didn't look feminine anymore. And she missed feeling pretty. She began to buy makeup and dresses and skirts on the sly and wear them when nobody was home. But she felt there was no going back. She kept trying to tell herself that this was all part of the post-op process, but by 11 months after the surgery, she was beginning to piece together the roots of her unhappiness. She was taking a psychology class at the time, even though she was only 16, and they were reading about the Harlow experiments on monkeys that explored the bond created through the physical affection of skin-to-skin contact during breastfeeding, and for the first time, she realized that she wanted that, as well as all that she had permanently lost before she could even understand it. She felt she was learning a lot about herself through that class, and for the first time, she realized that she wanted to have children, along with all sorts of things that she had naturally never experienced before at only 16. After all, 16 is an age where you learn all sorts of new things about yourself. She began to realize that her fertility might be permanently affected by the puberty blockers and the testosterone that she had been taking for years. One night she started crying and broke down about her regrets to a friend. She shared her feelings with her mother via a text because she felt guilty and ashamed for having put them through all of this for years, only to change her mind now. She felt like she was letting them down. They had invested so much time and money, and her body was permanently changed, and she had been so certain. She felt humiliated to have to admit that she had been wrong, and yet she couldn't hold it in anymore. That night, she decided to stop taking testosterone, to grow her hair out, to buy new clothes, and just figure things out from there, one step at a time. She isolated a lot in her room and was depressed, understandably so. Her family tried to support her and give her space. She had to tell her therapist, her gender specialist, and her endocrinologist that she regretted her transition and wanted to detransition. And unlike the first time around, there was no validation or guidance on how to go about that. She asked her endocrinologist for blood work to be tested on the basis of what her levels should be as a girl. Her endocrinologist did the blood work, but sent the test off with instructions to evaluate her levels as though she was a boy. Chloe says that this was when she knew she wasn't going to get any more support. She lost a lot of friends. The activist branch of the trans community, and I'm making that distinction, this is not everybody in the trans community by any means, this is the activist branch of the trans community, and their staunch allies have been especially vicious to her since going public with her story. Strange, given their claims that they just want everybody to be their real selves and to be happy. One person has persistently harassed her, saying that she deserves everything that happened to her, deserves to have parents who let her do this to herself, and that by sharing her story, she was potentially harming, quote-unquote, real trans people. For a while, she gave into this pressure, but she started discovering other communities on the internet full of people like her who had detransitioned. That was the first time she realized that she wasn't the only one to change their mind. It was happening to a lot more people than she ever imagined, so she began speaking out again. She lives with physical complications to this day. The grafts have never healed properly and have to be bandaged every day to keep them from leaking. She has joint pain in her arms and legs and back from the puberty blockers and cross-sex hormones. She still has ongoing urinary tract issues that affect her quality of life. And at 18, she was already experiencing sexual dysfunction, which she shouldn't be experiencing until much later in life. How was I supposed to know? She asks. She continues to pick up the pieces of her life and views herself as a, quote, broken woman. All of this because she was allowed and even encouraged to make adult decisions when she was just a kid. Even so, there is such joy that lights up her face when she talks about reveling in her newfound womanhood for the first time in her life, enjoying putting on makeup and styling her hair. It's truly touching to see her happiness and sense of belonging. Scott Nugent is not a detransitioner. Scott founded Trey Voices to help people who struggle with gender dysphoria. Scott often receives death threats for this work, which includes warning the public about the dangers and side effects of these surgeries, especially as regards minors. Quote, "You're going to have them do an experimental procedure that creates the most suicidal ideation of any other population 7 to 10 years after transition? And here's what I tell parents. You don't have the right to medically transition your child." That may sound extreme, but with no long-term studies on what a lifetime of taking these hormones does, it can't be called anything other than experimental. And we do know that only 10 years of taking these cross-sex hormones produces cancer. And here I want to just clarify, in case you're unfamiliar with these terms, if a woman takes estrogen, that's one thing. If a man takes testosterone, that is one thing. These are natural hormones. But a female body does not process testosterone the way a male body does, and vice versa. So a cross-sex hormone is when someone who's biologically female is taking testosterone, or somebody who's biologically male is taking estrogen, and we know that only 10 years of that causes cancer. Quote, "I never fit in. I was an alpha female, a sales executive that just didn't fit in any box. When psychologists or somebody that I was in love with or whatever said that I was in the wrong body, I started to think, well, maybe I am. I'm a biological woman." Scott was born Kelly, that medically transitioned to appear like a male through synthetic hormones and surgery. I will never be a man. Is it transphobic for me to tell the truth? Why is it that in a couple hundred years from now, if you dug up my body, they're going to go, "Yep, that was a woman, had babies." I've had 7 surgeries. I've had 1 stress heart attack. I've had a helicopter life ride with a pulmonary embolism. I've had 17 rounds of antibiotics. I've had 6 inches of hair on the inside of my urethra for 17 months, which was a complication of Scott's bottom surgery. Nobody would help me, including the doctor that did this to me, because I lost my insurance. I get infections every 3 to 4 months. I'm probably not going to live very long. Scott says there was no discussion about the risks and long-term side effects of these surgeries beforehand. Quote, "And I know that people want to think that there is," meaning discussions, "but there's not. The truth is medical transition is experimental. We have studies that said that medical transition helps mental health with kids. They've all been retracted, modified, changed. But the only long-term study tells us 7 to 10 years is when transgender people are the most suicidal, after surgery. But that's transphobic to say. For the first time in history, a marginalized group has a huge dollar sign on the top of their head. We have 5 children's hospitals in the United States promoting that, Scott said, displaying her mangled arm that was carved up for the tissue needed to create a poor imitation of a non-functioning penis. Quote, "That's a phalloplasty. That's a bottom surgery. We have 5 children's hospitals in the United States telling girls that they can be boys at $70,000 a pop in a surgery that has a 67% complication rate that will kill me from infection that I can't sue on. We're butchering a generation of children because nobody's willing to talk about anything. I have 3 kids," Scott said through tears, "at the age that they're doing this to kids. I'm not transphobic. I love my kids, and I love other people's kids, and you should too," Scott pleaded. "This is wrong on so many levels." I would remind you, Scott is not a detransitioner. Scott says that kids are not capable of understanding the ramifications of this choice fully enough to even give meaningful consent. Quote, "Being a parent is loving the hell out of your kids and helping them see around corners." End quote. It is just not true that puberty blockers are always reversible. And it is certainly not true that they have no long-term side effects. And cross-sex hormones are even worse. They do have lifelong repercussions, often serious ones. Some argue that you can pause puberty and then pick back up where you left off. Scott says, quote, "No, you can't. No, you can't. How many studies do they have? Long-term studies on hormone blockers with children. None. Children in their early teens who have been on puberty blockers for as little as 2 years have developed serious osteoporosis. The combination of puberty blockers and cross-sex hormones often renders the user permanently sterile and completely infertile. These are the same drugs used to chemically castrate sex offenders. There has been a rise in life-threatening tumors associated with these drugs. Quote, "Every child that they convince is transgender and in need of medical transition, it generates $1.3 million to pharma. And we're believing a pharmaceutical company, Lupron, hormone blockers, reversible, so they say. Well, the truth is, in 2003, Lupron was sued and deemed a criminal enterprise by the U.S. government. They paid the most fine of any pharmaceutical company at the time, $874 million. Wrote a check. When asked if Lupron was chemical castration, Scott said, "Yes, we're giving it to pedophiles, aren't we? We're giving it to people that are dying. And we're giving it to kids, telling them that they were born in the wrong body and it's, quote, completely safe." Brianna Ivy is another person who is not a detransitioner. Brianna was born a male and began taking cross-sex hormones at 15 in order to transition. Brianna continued the transition process all the way through sex reassignment surgery, which brought about incredible pain and horrific complications. When it comes to pronouns, Brianna says, quote, "That's the least of the worries I have when confronted with someone who is uncomfortable using preferred pronouns. And I don't think that's disrespectful. I am he. So I will follow that lead and be as respectful as possible, using the name Brianna, while trying to be clear about the realities of Brianna's story, which is going to occasionally force me to use pronouns, in which case I'm going to have to use the biological pronoun in order to make the story make sense." Brianna started feeling confused about his gender when he started grade school. Quote, "I was a very feminine young boy, like all the way down to my voice, my mannerisms, the way I spoke. I would immediately go to the girls' line when we would line up in school, and actually my teachers were okay with it because they knew that's where all my friends were." Brianna was taunted cruelly by the boys. It was unacceptable to be a boy that was more effeminate in personality and mannerisms. Brianna says there was no safety among the boys. They would sometimes even touch him inappropriately, but among the girls, he could be safe. Brianna also grew up with a biological father who made some comments about gay people, and it was clear that this proclivity would be treated with disdain. Quote, "I remember feeling disgusted by the thought of me growing up as a feminine man. I could not envision myself as an adult gay male. Like, it just felt gross to me, and I just didn't like anything really about me. When faced with the option of being a gay man," quote, "I had that exact thought. I thought transitioning into a female is the better of the two. And I could see that as my future. It seemed better to me. It seemed more acceptable to me." But it wasn't until Brianna was 12 or 13 that he first thought maybe he wasn't just a gay boy, but that he might be trans. He might actually be a girl. This was brought on by seeing Jazz Jennings on TV. Brianna was also being exposed to a lot of trans people online. Quote, "It really convinced me that that was me." The older trans people online were always regretting that they had not been able to transition when they were younger in order to be more convincing in their appearance. This became very important to Brianna. Brianna followed the advice of the transgender people online and wrote his mother and stepfather a letter explaining what he was feeling and what he wanted to do. Brianna was deeply unhappy and on the verge of giving up, and his mother sensed his genuine distress, so they all went to a gender clinic together in order to get some guidance. The first step was talking to a social worker for about half an hour. Then Brianna was assigned to a doctor to supervise his case, who immediately prescribed him hormones. He was 14 at the time. Brianna was put on a testosterone blocker, given estrogen, and given 2 puberty blocker injections in the first 6 months. Brianna did not have to see a therapist for any of this. Quote, "I look back on it, and I wish I had more time. I wish I was really allowed to speak and sit with someone that really gave me the space to really take the time to talk about everything. Because I was so young that all I wanted was a miracle. All I wanted was a quick fix. I wanted something that would just get rid of the shame immediately. And that's what I was made to believe it was. And so I just took it, and I was thrilled." At first, taking control of his life and starting on the hormones was an incredible high. The promise of being able to look the way he always thought that he should was powerful. The hormones caused him to lose a lot of hair all over his body. He started developing breasts because he was so young when he was taking these high doses of estrogen. Quote, "I watched my body completely change in real time." These changes began occurring within about a year. Quote, "I felt like I was finally being fully feminine in a way that I felt like would be more acceptable to people." Brianna's family decided to move to allow him to start high school with a clean slate, but his transgender identity was hardly a secret. There were discussions about how to accommodate all of this before school started. Quote, My mom and I met with the principal and officials of the school to talk about the bathroom and how to navigate that. And for me and my mother, our biggest priority was not only my safety, but everyone's. We were never there to ever cause a problem, to ever make other people uncomfortable, because that doesn't make me feel better, to make my community feel uncomfortable and to make them feel threatened. End quote. This is an attitude that I both applaud and appreciate. Quote, so my mom and I said, what is a solution that can not only protect me, but also protect everybody else for people that don't feel comfortable sharing that space? So they allowed me to use the girls' restroom, but for a while I used an independent one, like a teacher's, because I think it was for everybody's safety and comfort. It was the right thing to do. My take on that is trying to make trans people feel comfortable is important. But so are the feelings of everyone else. Brianna strongly disagrees with the tenor of the current conversation, where many trans activists, and again I'm making that distinction, because there's many trans people like Brianna who disagree with them on this, but the trans activists are pushing that their feelings are the only ones that matter, and everyone else just needs to get over it. In every situation, with children of all ages, and based on nothing more than self-identification, etc., Brianna believes that everybody's feelings on this are equally important and should be considered. I agree with that. I don't think any one group ever gets to be the only one that matters. Brianna still had a difficult time in school. He didn't completely fit in anywhere. There were intimate questions on the very first day from curious students. 3 years later, he was still basically alone. Quote, I thought that I would feel brand new, and my mental health did not get any better. Which is not surprising because his mental health wasn't being addressed at all. It was being treated as though his mental health issues would clear up magically if he transitioned, but they didn't. Those are two separate issues. They may be linked, but they're two separate issues. By 17, Brianna was, quote, passing, which is a term used by the transgender community, which means that when the outside world sees you, they assume you are the gender you're trying to present, as opposed to the world recognizing that you are, for example, a man who is dressing as a woman. And even so, his mental health did not get better. Neither did the way he felt about himself. This is important. This part is important because many people argue that if a transgender person continues to have suicidal feelings, it is because they're not being accepted enough. But Brianna was being accepted because most people did not even know that he was trans. He looked female. Still feeling like something was missing, Brianna became convinced that completing the process with surgical intervention would fix everything. Also, this time was confusing for Brianna, as it is for most teenagers who begin entering the dating world. Brianna was attracted to men, but the hormones kept him from experiencing sexual feelings. And of course, his options were extremely limited, as most gay boys wanted to be with other gay boys who were living as a boy, not as a girl. And the straight boys viewed him as a boy, not as a girl, no matter what he looked like. Even now, in his early 20s, he still has no real idea what having a sex drive is supposed to feel like. This is likely a permanent result of the puberty blockers and estrogen. Still feeling empty, Brianna kept turning back to social media to see what other trans people were doing, and it seemed to him that the trans women, like himself, meaning men who had transitioned into being women, the ones who had made it and were happy, seemed to be the ones who had gone through all the surgery. Having the surgery was even somewhat of a status symbol within that community. Quote, and that's all I wanted. I thought that was what I was missing. Like, it just felt like, oh, maybe I'm not transitioning enough, and so I've got to keep going. Brianna discussed procedures with his doctor, who was able to coordinate with the gender clinic to get him consults with the appropriate doctors. Quote, I remember my mom, my stepfather, and I, a very common theme every time we were in the gender clinic was that these surgeries and doing all this young, you won't even really feel transgender. You'll look like a biological female. You'll be one. And that came up a lot once I got to the bottom surgery. But that was a common theme that was present within the clinic. And that was something that I picked up on really fast. And then adding in social media and the other trans people I was seeing sing jazz, they gave me the idea that I almost wouldn't have to be transgender, because if I do this all really young and fast, then I feel like I can skip that. And they made it feel real. They made it feel like that was a real thing. And I want to interpose something here. This is what I see is dangerous about our choices in language, and I think we need to be more conscientious about our language. It's a very popular slogan right now to hear people chant, trans women, meaning men who have transitioned to being women, trans women are women. Now that's a catchy slogan, and I know what people mean by that. What they mean by it is that's how they see themselves, and therefore to be polite, to be accommodating, we should try to treat them as much in that way as is possible. But children are literal creatures. They just are. And no one, not even the people chanting that, believe that that is literally true. Nobody believes that a biological male who transitions to being a woman, that like Harry Potter comes and waves a magic wand and suddenly his XY chromosomes become XX, he grows a uterus and starts menstruating. Nobody believes that, even the people chanting it. That's not even really what they mean. They mean that the way they see themselves is more important than biology, and that people should treat them as though they are women. That's what they mean. But the slogan, the choice of words, that trans women are women, confuses kids like Brianna, because kids are literal. And I think we have to prioritize kids who are impressionable and vulnerable more than a fully grown adult who may like that slogan and may have their feelings hurt by it. We can come up with another way to make the point that you should treat everybody respectfully, etc., without choosing slogans that add to confusion for children who can't differentiate the subtleties of language that way. We all need to really stop and think about what we're saying, and not just say something for a political reason that might harm a child's mental growth. As soon as he was legally 18, he told his parents that he wanted to pursue the final step. Brianna had mapped out all the surgeries he wanted during his teen years, and he had already had 2 by the age of 19, and in less than 6 months, he was having the bottom surgery. Brianna's first consultation was with a popular TikTok doctor named Dr. Gallagher. This doctor is popular for making short videos about these procedures, which present them very lightheartedly, set to pop music as though they are so easy, so quick, so risk-free, and the answer to everything. And many young people believe her. Quote, it definitely downplays what these surgeries really entail. Like, these are not even comparable to typical plastic surgeries. These are completely reconstructive. And they're being treated in the same manner as almost like getting breast implants, says Brianna. Quote, so there's a few different techniques that you can do in terms of the male to female surgery. She had gone over 2 of them. That was really it. And I didn't realize that immediately after my appointment, she relocated to Florida. So that was when I was referred to Dr. Joshua Roth. He studied under her. And then that was how I came into contact with him. She sent me to him. And this is the part where it gets a little bit graphic, but, it's part of this conversation. So I'm going to continue on in Brianna's own words. Quote, they handed me a blue piece of paper, and it was like taking an order. Like, how do you want us to do the surgery? Here's 3 different ways we can do it. And they told me that there is a certain technique that was a breakthrough, and that it is going to be identical to a typical biological female genitalia. And they said that this is brand new, and this is like a miracle almost. The 3 different options came down to this, quote, so the most common and the most practiced is referred to as penile inversion. That is when the inside of the organ is composed of the penile tissue. And it is exactly how it's stated. It's inverted almost, internally. That's been the longest form of the surgery. There is another one that is also practiced. It's called the sigmoid colon graft. That's where they take a graft of the sigmoid portion of your colon, and they use that for the internal organ. There's a lot of complications with that. You typically have a colostomy bag. There's also smell associated with that and risk of infection. It is possible, although a lot of surgeons don't prefer it. And then what I had was something I had never heard of until I went to Dr. Roth, and it was called the peritoneal pull-through vaginoplasty. They went in laparoscopically into my stomach, took out the inner lining of the skin, and it's called the peritoneum, and they used that graft to create the internal organ. The doctors online and Dr. Roth had made it sound easy, with a 4 to 6 week recovery, completely downplaying the pain. The reality turned out to be very different. When you're on the puberty blockers for a long time, you don't develop as a male. So these boys are often left with micropenises, and there is not enough tissue to even do the transition surgery, forcing them to resort to one of the other 2 options. It was technically possible, in Brianna's case, to do a penile inversion, but it was far from ideal, and the results would not have been very significant. Brianna had to choose between the colon option, which was even further from ideal and often doesn't have very favorable outcomes, or this new miracle option. He was given no time to reconsider, just long enough to get the insurance approval and book the surgery. It took about 2 weeks for the insurance and a few more weeks to schedule the surgery, a couple months in total. The night before, he was excited. Quote, I thought I was going to feel like a normal person for once. This is the promise that my family and I have been sold since I was a kid, that we will make her into a real woman. She doesn't have to deal with what older trans people go through. She won't have to look in between. We will do it all young, and it will be perfect. I mean, like my mother and I to this day truly believed that up until recently. That procedure was 7 hours, and immediately I woke up. I could not walk for the entire duration I was in the hospital. I had severe pain all over my body. I actually had an epidural in because of the pain. I could not use the restroom. And just a few days later, I had blood clots in my legs. I had a DVT. It's a deep vein thrombosis. It's a large clot that was in my leg. And they only discovered it because I had a fever. And from there, I had to be on blood thinners for 3 months, and I had to do injections every day. I was in so much pain. Like it was searing pain. And I was in the hospital for maybe about 2 weeks. And during my time there, I remember there was an intense fascination with what was being done to me. I remember specifically nurses at the hospital, residents of the hospital, various people there. They would come in. They would look at me. They would tell me, this is so cool. We've never seen someone as young as you have this done. We've never seen this surgery done here. I remember people coming in and out. I remember Dr. Roth would bring in multiple residents to just watch me while I was sitting there. And I couldn't walk. I couldn't move. I was in so much pain. People just came in and it was like a science class. And immediately from there, nothing was recovering. It got worse over time. Immediately going home, this is not typical, and they told me this wouldn't happen, but during a procedure like this, they completely shorten your urethra because obviously you don't have a penis anymore, so they have to cut it and put it right at the body. And mine was so swollen that I had a catheter for about a month attached to a bag, and I could feel it like every second. And you also have to dilate when you have this procedure. They're essentially like plastic, like large, almost like toys, very similar to that. And you have to put them in and leave them in for 30 minutes at a time. And it felt like a knife inside of me. But I was terrified to not miss a second because I would feel like all of this was going to waste. And I would lose everything that I thought I had wanted for so long. But every single day the pain was worse and the bleeding was worse. I would bleed all over the bed every time I would do it. And I knew even just a month or two in, something was really wrong. The way dilation works is they give you 4 different sizes and you were supposed to work up to the largest. But I was going backwards. I would try so hard. The surgeon told me, you just have to make it fit. You just have to put it in. And I couldn't. I felt like I was being shredded inside. And I had no idea what was happening. I would try and call the doctor. I would say, this feels wrong. There is just no way that this is what it's supposed to be like. It looked horrific on the outside. It didn't, and it still doesn't really look like any kind of genital. It looks like something in between. And I remember that even from when I had the surgery, it looked horrible on the outside. And everything felt wrong in my body. And I would try and call for help. And he said, it's just normal. Try using more lube. Take deep breaths. Try a different angle, like using a pillow. And it made no difference. And I was constantly being told that. And even when we went in for checkups, he just kept saying things were fine. He was like, things are fine. My mom would be there, and he was like, this is fine. And I would ask questions. I'm like, what about this pain? I'm still bleeding. I'm still, having discharge coming out. I'm still in so much pain. Even 2 months later, I would walk, and it would feel like there was a brick right here. It was just non-stop pain. And he said, it's fine. It'll go away. And then just a few months later, I got to a point where I called him and said, this pain is not going away. It's getting worse by the day. When I try and dilate, I feel like I'm ripping myself apart. And he said, just take antibiotics for 2 weeks. And I never had an infection. It wasn't until the end of that year that I finally called and I said, I need to come in. There's something so wrong here. And I don't understand why no one had me actually come in and really look. They finally had me come in. They did an ultrasound, and it's called a vaginoscopy. It's where they go in and look, and there was no infection. What was happening was I had scar tissue, all internally from the new organ, and it was collapsing and causing my pelvic floor trauma. And he told me, there's no recovering this. There's just no way. Your body is completely rejecting it. And so he said, you can just stop dilating. It's going to close up either way. And he said that there was just really no other way to fix it besides another surgery. And I cried and I cried in that room because I thought, I fought for this to work. And when it didn't, that was the reason I never finished school, because I was recovering that whole year. I thought that all the pain that I had been through and put my family through was for nothing. And I cried in that room, and all he said was, I'll give you a minute. And then he came back in, and he told me, we'll have to do it again, and this time we're going to have to use a graft from the colon. So we're going to have to do it that way. He sent me to another specialist, pretty much just a few months later, because in order to do that surgery, you have to go to a colorectal specialist who takes the graft. I met with him, and he said, "There's no way I will do this to you." He said, "Your pelvic floor is so traumatized in these MRIs that it will be severely worse complications if it happens again, or you could lose your life." And I felt like my world was over. And then I went back to Dr. Roth and I said, "Why is he saying this? You told me that, just meet with him and then he'll tell you kind of how it'll work and then we'll get you in for the second surgery." He said, "That's not possible. Like, it can be done." So he sent me to another one. I met with him. I met with a second colorectal specialist. And the same thing. He said, "I will not operate on you. Like, this just can't be done." Like he said, what happened to you the first time will happen again, if not in a worse way. And he refused. And I went back to Dr. Roth and I left a voicemail and I said, "This is the second surgeon saying this, and you're still telling me to do this second surgery. Like, I'm confused. Every other doctor is refusing to almost kill me from doing this." And I lost contact with him. End quote. He just ghosted Brianna after that. At only 20 years old, Brianna was left to pick up the permanently shattered pieces of a life that will never be normal. Quote, "It wasn't until that moment that everything they told us was a lie. And that's why I get frustrated. I see so many people now in this year advocating for the exact process I went through. But in reality, when people have that kind of surgery, the best candidates are people that have gone through a full male puberty. They have all sexual functionality. They have all of their organs and tissue intact. But when you go into the gender clinic and they'll tell you, if you want to look good and be treated better, start now, start young. But then you give up everything." Brianna chose to share this story because information is power. Whether you are a trans person, whether you are not a trans person, whether you are choosing one team or the other to cheer for and yell at people on the internet who are on the other team, this is not a detransitioner. This is a biological male who still identifies as, thinks of himself as, and lives as a woman. His life and future was entirely destroyed by these surgeries, brought on during a time when he was still a child who could have benefited from real therapy that might help him come to grips with his homosexuality. He might not have needed to go through what can only be described as horrific mutilation. Quote, "I've sat back and I've had to live with this for so long, because any time that I had shared this story privately, especially to other transgender people, I was told that I should be grateful that I got to do all this so young. I was told to never say that because it would make us all look bad. And I was told that, oh well, you can still have sex in other ways. It doesn't really matter. They were just coming up with excuses to make it seem like it's okay that this happens to people. At 14, when all of this started, Brianna didn't think he would ever want children, so he wasn't bothered by the fact that he couldn't afford to freeze his sperm. Now that's one of his biggest regrets. Quote, "And the same with the procedure. I just wanted a miracle. And they painted the rosiest picture in the world. It wasn't until it was within a few months I tried to look into what it was that was done, because I noticed that there was no one talking about this surgery, this technique I had. And that's because the first time it was done was in 2017 in New York. It actually was never intended for transgender patients. It was for biological women who have deformities or are born without genitalia. And so this is a way to correct that. And so in New York, they pretty much just copied and pasted the surgery onto a biological man to see if it would work. Aside from their insurance, Brianna's family had paid over $170,000 for this process. But suing a doctor for malpractice requires you to have other doctors that are willing to say that what they did was crossing the line in some experimental Frankenstein way. And I know from experience that most doctors have each other's backs in case they are ever falsely sued and need the favor returned. Quote, "My mental health was destroyed. I couldn't finish school because I was so behind, so I didn't. I didn't know. It made me really question who I was supposed to be, the life I was supposed to have. Because everything that I've been told for the last almost 10 years was not true. And so now I'm stuck. And I have all these feelings about wanting to have a family, wanting to be like in a relationship, wanting to have those experiences that other people have. And I don't even know how to feel that because I have none of them. None of those feelings. Even in that area, it's very numb. It doesn't even look like an actual genital. It looks in between. And every day when I look at it, it's just painful. And I don't know how I'm ever supposed to have those experiences that other people have because I decided so young to give it up." Brianna struggles to find the strength to go on. Quote, "I knew that I had the chance to turn this into something good. I knew that I had the chance to give people truth that a lot of people don't because no one is willing to explain exactly what this does to you. No one who has ever started this as a kid is willing to explain what you actually give up to do this, and the lies that they'll tell you, and the fact that doctors in these gender clinics will take vulnerable children and families, and they'll sell them a promise because they're desperate. They're desperate, and it only gets worse. Because in reality, a lot of transgender doctors are really activists first. For example, Dr. Roth, he actively pushes to open these clinics, actively pushes to push these surgeries further and further. That's their main focus before even practicing the medicine. And they're well aware of this. And transgender people, especially children, have the most complications. And you are a lifelong check. I still go to the same people that did that to me. Because I can't stop my hormones. I have no organs to produce them. So I have to take something. Brianna has dealt with this by turning to faith, turning to God. Quote, "And it makes me feel whole again. And I knew that I just wanted to give up. I didn't feel like a human. And he reminded me that I still am. And that I can give people another chance to take their time before they sacrifice everything for this." I'm so excited that people get to hear a real story of what being a transgender child is like, because it's very hard to find. Very hard to find anyone that will go into detail, because the ones I have spoken to are completely silent because they're ashamed. It's only after I decided to first speak about it that I've now had so many reach out to me who have been through horrific medical experiences, and they're ashamed just like I was. And they never want to acknowledge it again. I'm really excited that other families that I know are so vulnerable and desperate like we were, that I know that it's not parents that just want to use their trans kids to make a political statement. It's parents that just want to make their kids feel normal because they don't want to lose their kid. They don't know what to do. And that was my family. And I'm glad that I can show them that there is no need to let these doctors tell you to rush this, because you just cannot go back. Even if I decided one day to just try and go back, that's more expense that I have to pay to have things undone. And even trying to switch the medications would probably destroy my body, as I've been developing in a certain way for so long. Like, none of this is reversible. And in that, you need to take your time and really talk to your kids. Know your kids. Like your kids don't even know themselves. And so I'm really happy that this can be an opportunity for them to see that there are so many sacrifices made as a kid in order to do this. And it's not all worth it. I am scared because I know how personal this can be to a lot of people. I know I've already been threatened many times, me and my family, if I ever talked about this or shared this. And more than anything, I want my parents protected. The guilt and the shame that I feel because I felt like I dragged them through this because I was desperate to feel normal. And the pain that they went through when they saw this just kind of fall apart, that's more than anything. I can handle really anything. I've been through a lot, but they don't deserve that. End quote. There are around 300,000 minors in the United States who identify as trans. Texas surgeon Dr. Eitan Haim was a whistleblower who exposed the famous children's hospital where he worked for continuing to do sex change operations on preteens. On March 4th, 2022, Texas Children's Hospital issued a statement saying, "The mission of Texas Children's Hospital is to create a healthier future for all children, including transgender children, within the bounds of the law. After assessing the Attorney General's and Governor's actions, Texas Children's Hospital paused hormone-related prescription therapies for gender-affirming services. This step was taken to safeguard our healthcare professionals and impacted families from potential criminal legal ramifications." But Dr. Haim found out that the hospital was continuing to implant puberty-blocking devices into 11 and 12-year-old kids. So he blew the whistle. While being very careful to protect the identity of the patients involved, he did reveal that the hospital was continuing to provide services that were illegal. Then, on June 23rd, 2 federal agents pounded on his door who were with Health and Human Services and said they were investigating a violation of medical records. When he went on Dr. Phil's new network, Merit Street Media, Dr. Phil said, quote, "I've looked at the documentation that you provided, and it looks to me like you went to painstaking levels to protect the identity of the patients involved." Despite this, he has been charged with 4 felonies, claiming that he violated HIPAA, which, for those outside the U.S., that is the laws regarding patient privacy in medicine. He's been accused by a weaponized justice system for political purposes meant to advance a desired agenda and in order to intimidate other would-be whistleblowers. And this doctor is not the only whistleblower with concerns. Dr. Phil also spoke to a caseworker who worked at the Transgender Center at St. Louis Children's Hospital, Janie Reed, who is herself a queer woman married to a trans man, a woman who transitioned into a man. So she clearly isn't transphobic. She says, quote, "We started to see patients who were experiencing very significant medical harms. The patient said, 'I'm bleeding. I've bled through the pad. I've bled through my blue jeans. I've bled through the towel that I've wrapped around my waist, and I've soaked the sheets on the bed I'm sitting on.' They had to basically try to suture back together their entire vaginal canal. It had torn open." I'm sorry to keep being graphic, but the realities of these situations need to be understood in order for people to decide if they really want to keep promoting this. And maybe if enough people understand what you're actually talking about, we can help some of these kids. And as I said at the beginning, I'm talking about kids here. I'm not talking about adults. That's a subject for a different day. We're talking about should minors be doing this. Dr. Haim says, as a surgeon, as a doctor, you make an oath to do no harm. If this is happening and the hospital is lying about it, it's my responsibility to do something about it, and especially when what they're doing is harming these children. I'm facing missing the birth of my first child, possibly the first few years of my first daughter's life, 10 years in prison, for doing what was necessary to protect these kids. But the thing I fear greater is delivering my daughter into a world where her parents were unwilling to stand up, and I couldn't imagine doing that. We saw the extent of the corruption that was coming from the Department of Justice, and my attorneys had written a letter to Congress outlining the misconduct. And in it, the prosecutor had said that they were going to bring me to a jury trial, even if they were going to lose. The implication being that they just wanted to bring me through this process because the process is the punishment. Because we've lost everything, all of our savings, all of our investments, our retirement, everything. And any other whistleblower, if they're thinking about coming forward, they know those are the stakes. So what better way to discourage those people from coming out than to drag me through this? Speaking of the indictment, he said, quote, "There was a degree of vindication after I read it for the first time because what they're alleging is so divorced from the reality of the truth that there's no way possible that the FBI can be so incompetent as to get the facts so wrong." Dr. Phil labeled all of this as prosecutorial abuse, and he's right. It's designed to intimidate other people from coming forward and speaking out, which is exactly why we all have to do that very thing. No matter which side you come down on as far as the medical issues at stake, everyone should be on the same side that you are not allowed to weaponize the law and the courts and the agencies to get even with people who disagree with your political agendas. This has to be stopped. It is becoming far too commonplace on far too many fronts. Quote, it's scary. It's very, very scary that a doctor cannot practice medicine if they violate that oath. If they work in the hospital where the hospital is lying to the public about manipulating, mutilating, and sterilizing these kids. That we no longer become doctors if we don't expose that, if we don't do something about that. Dr. Hines' wife, Andrea, who is a federal prosecutor, says, quote, "I wake up every morning until I go to bed at night, thinking about the fact that my husband, because of this federal indictment, may not be there when our daughter is born, may not be there for the first part of her life. But as bad as that is, it's truly a privilege to take on this fight because I truly believe that people like Eitan, being so courageous and standing up for the truth and standing up for the kids that are being mutilated and sterilized is the only way that we're going to get this practice to stop." She continued, quote, "The level of corruption in this case is unimaginable. I would hope that if I had done even an ounce of the actions that this prosecutor has taken, that not only would I be fired, but my law license would be revoked." The system has been threatening Andrea as well. She says when the agents came to their home in June of 2023, she advised her husband of his constitutional right to request an attorney. And in order to retaliate, the prosecutors threatened to tell the investigators who were doing the background checks on her for her security clearance at her job that she had interfered in a federal investigation by reminding her husband of the right that he did have to have an attorney. Britain is starting to regain its sanity on this front. Victoria Atkins, the UK's Secretary of State for Health and Social Care, recently told Parliament, quote, "In 2020, NHS England commissioned Dr. Hilary Cass to examine the status services for children questioning their gender. This review strikes hard and strikes sure at an area of public policy where fashionable culture values have overtaken evidence, safety, and biological reality. In 2022, more than 5,000 children and young people were referred to gender identity clinics. This exponential increase in demand was driven by a myth. This myth was that the answer to their question was inevitably to change gender. This near uniform prescription was imposed on children and young people with complex needs. Since NHS England commissioned the review in 2020, they have recommended how to design a fundamentally different service that better serves the needs of our children, end quote. Dr. Leora Sapir, a fellow at the Manhattan Institute, where he focuses on the research behind gender in society and on pediatric gender medicine, said his response to the prosecution of Dr. Heim was, quote, shock and not shock. Shock because they are trying to send him to prison for doing little else than trying to protect the health of children and expose malpractice in his own profession. But not shock, Dr. Phil, because the truth is that this issue has been heavily politicized in the United States. The Democratic Party at the state and federal level is aggressively in support of these procedures for kids. It will not tolerate any disagreement or even skepticism, in stark contrast to health authorities abroad that have looked at the evidence and have decided to change course in recent years. The American Medical Association, the American Psychiatric Association, the Endocrine Group, American Academy of Pediatrics, and more have all backed these procedures on the advice of a political group of activists. Not a medical group, a political group known as WPATH, the World Professional Association for Transgender Health, who admit in their own documentation that these so-called vaginas that they create are actually just, and I'm quoting, open wounds. Dr. Phil reminded everyone that these so-called experts don't have the best track record. Quote, the American Medical Association, it's behind this. Of course, that's the same one that at one point in time recommended smoking to handle your anxiety, so they don't always get it right, let's face it. But I think they've just caved to political agenda. The tyranny of the fringe coming in, threatening to just give them all kinds of harassment and trouble if they dare speak the truth. But is there any empirical evidence that suggests that they can say with confidence that there is not long-term problems with this? And how can they speak that this is the thing to do if they don't have that? Dr. Sapir replied, that's a great question. I think the definitive answer to that question came out a few months ago from the UK in the form of a 400-page report, and it's known as the Cass Review. And as part of the review, Dr. Cass and her team also commissioned 7 new systemic reviews of evidence and of medical guideline quality. And those systematic reviews came back with the exact same conclusion as every other systematic review that has ever been done on this issue today. That puberty blockers, cross-sex hormones, surgeries, the evidence that these interventions in minors are safe and effective isn't there. Which means that the risk for long-term irreversible harm is significant. There were a few other very important findings of this review, one of them being that when a child says, I'm transgender or I'm uncomfortable in my body, especially when this happens around the time of adolescence, which is when everyone feels uncomfortable in their body, there's no way for clinicians to be able to predict which of these kids will go on to have a lifelong struggle with their body. Dr. Hilary Cass concluded that youth gender medicine is, in her words, built on shaky foundations. She said that its doctors and medical associations, the very ones that you cited, are, in her words, out of date on this issue. So we are becoming an outlier, end quote. And we're doing it to please not just a very small subgroup of society, transgender people, but a very small group of those who are activists first. They are free to do what they want to do in their own lives, but should not be the people in charge of what happens to the rest of us, especially what happens to our children. The CAS review also included a survey asking patients why they detransitioned. 70%, 7 out of 10, said it was because they, quote, realized that their gender dysphoria was related to other issues. 62%, almost 2/3, said it was, quote, health concerns. 50% said because, quote, transition did not help with my dysphoria. 45%, almost half, said they, quote, found alternatives to deal with my dysphoria. 44% were, quote, unhappy with the social changes. 43% said it was due to a change in political views. Think about that. 34% said, quote, dysphoria resolved itself over time. 30%, nearly a third, said, quote, comorbid mental health issues related to dysphoria solved. Only 13% said a, quote, lack of support from social surroundings. Only 12% said, quote, financial concerns. And only 10% said, quote, discrimination. People getting liver transplants have to stay in the hospital for shorter periods of time than people getting bottom surgery. A totally healthy person doing a surgery so radical that they require the same amount of time in the hospital as someone on death's door getting a transplant, the highest end of the most invasive procedure that we even know how to do. These surgeries are Frankenstein-level experiments. Their complication rates would never be allowed in any other kind of surgery. As someone who's had 25 surgeries, I can vouch for that. If you had more than 2/3 of heart surgery patients or brain surgery patients having complications, we would not be doing those surgeries, even to save lives, much less be doing them on children. One day, we are going to look back on all of this with the same horror that we now look back on lobotomies. So just be very careful what you propagandize for out of well-meaning motives without knowing the facts first. Parents are losing custody of their kids over this, or having so-called trans sanctuary states confiscate their children from loving parents with no history of abuse of any kind, simply for wanting their child to wait until adulthood to transition. And they're putting them in foster care where they do have very high odds of being abused. The depression and eventually suicide that is associated with gender dysphoria start before the dysphoria. And they aren't stopped by the surgery because the root issue isn't addressed, which is part of why we see so many suicides even after the final surgery. There are almost always comorbidity issues involved, including depression, anxiety, autism, homosexuality, or sexual abuse. These need to be dealt with either way in order to truly help someone, so why not at least start there before jumping to radical surgery? There are masculine girls. There are feminine boys. That doesn't mean that they were born in the wrong body, or that a tomboy is actually a biological boy. And this has all grown into the ridiculous to furries, people, and especially children, who identify not as another gender, but as another species. There are kids wearing costumes to classrooms and running around on all fours barking, rather than being encouraged to grow up and be mentally healthy. It has to stop. We can be empathetic. We can be empathetic toward people with true mental problems, and we should, while not indulging them in the desire that some of them have to spread their mental health issues to impressionable children. And they certainly are not stable enough or qualified in any way to be influencing the standards of health care that are leaving children permanently scarred and with lifelong health problems or causing parents to lose custody of their children. So where did all this come from? Two people. Alfred Kinsey was a radical reformer whose life was portrayed in the Liam Neeson film Kinsey. No offense to Liam, love you man, but the real historical story is pretty disturbing. He wanted to remove all Judeo-Christian values from society, especially when it came to sexuality. He is the father of our current sex education curriculum in schools in the United States. He argued that children were sexual creatures from birth, and he believed that happiness in life was found through extreme sexual experimentation at all ages. We now know that his research was fraudulent. That's a known fact. It was conducted on convicted sex offenders and child molesters in prison, as opposed to data collected from mainstream Americans. He also performed notorious sexual experiments on children, some of which were not even a year old. His book, Sexual Behaviors in the Human Male, contains an infamous chart known as Table 34, which documents the number of orgasms that children were capable of at different ages, starting at 5 months old, 11 months old, 2 years, 2.5, 4, etc., up through 14. Despite having conducted such horrific and abusive experiments for perverse motives, he is still celebrated in academia and memorialized in a major Hollywood film, and his influence lives on in the content of public school sexual education curriculums. Kinsey was followed by John Money, the father of trans surgery. Dr. Money was a psychologist and a professor at Johns Hopkins University. Our entire present-day gender ideology comes from this man. He even created the terms gender identity and gender roles. According to him, babies are gender neutral at birth, and it is 100% the way they are raised that will determine if they become men or women. He argues that every child was capable of becoming either. His theory that if a boy was raised as a girl starting before the age of 2, he would be just as healthy in that life as he would have been if he had been raised as a boy, and vice versa. And this began getting public attention in the 1960s. But he couldn't prove it until the perfect experiment landed in his lap, the Reimer twins. The two boys were identical twins and had a devastating accident when they were 7 months old that made them the perfect test case for his theory. They were taken in to be circumcised, but the machinery malfunctioned, and the first boy, Bruce, had his penis burnt off. So they did not attempt to circumcise his brother Brian. The young parents were devastated and torn about how to provide a meaningful life for their son. They saw Dr. Money on TV and turned to him for help and his expert guidance. He told them that they should transition Bruce into a girl while he was still a baby, and that as long as they never told him about his real identity, he would grow into a perfectly healthy and happy girl. They were hesitant, but he was the expert, and they knew their son would never lead a normal male life, so they followed his advice to the letter. They had Bruce castrated at 18 months old, and a crude vulva was created for him, and they began raising him as Brenda. Dr. Money continued to see both twins for years after that, and he sexually abused and traumatized them. He would even force them to simulate sexual acts on each other at their appointments. He lied in his book about the results of his little experiment, saying how much Bruce loved being a little girl. The reality was that Bruce was deeply unhappy. He didn't want to play with his girl toys. He would rip off his frilly dresses, and eventually he refused to continue seeing Dr. Money. The lies told about Bruce in Dr. Money's book were hailed as proof that there was no real difference between boys and girls, that whether one felt masculine or feminine was purely a result of the way one was raised. It was all a social construct. But that wasn't true. Feminists especially were thrilled with this case because it proved that they could be the equals of men in every way if they were raised better. The only problem was it was all a lie. Eventually his parents told him the truth because Bruce had grown suicidal, and he chose to transition back into a boy, taking the name David, and eventually speaking out on Oprah. Quote, "Suddenly it all made sense why I felt the way I did. I wasn't some sort of weirdo. I wasn't crazy." But the trauma that the family had been through proved to be too much. His brother Brian couldn't cope with everything and became extremely mentally disturbed. He overdosed on July 1st, 2002, and died. David used the money he got from the botched circumcision to create a penis and live as normally as possible, eventually marrying a woman with 3 children, which made fatherhood a possibility for him, since obviously he would never have biological children of his own. But he could not overcome the trauma he had been through, and on May 4th, 2004, at the age of 38, he committed suicide in a parking lot by shooting himself in the head with a sawed-off shotgun. He had attempted suicide twice before that. The boy's father sank into alcoholism, and their mother attempted suicide as well. The doctor responsible for all of this never acknowledged any of the damage done by his pet theory. And the ideas based on his falsified book still serve as the foundation of today's attitudes towards gender ideology. I'll leave you with a final story. Katie Anderson was 19 years old when she began transitioning from female to male. Now she is transitioning back to female and says that she lives every day in pain and with a lot of regret. Quote, "I would describe dysphoria as a constant inner voice telling you that you have all these flaws and that something needs to change. I was just searching for a solution. Vulnerable people are walking into gender clinics for answers, and doctors see them as big dollar signs walking through the door, and they do everything they can to get as much money as possible. It wasn't until I was a teenager that I became very uncomfortable with my body. I started watching YouTube videos, and I would just watch for hours all these teenage girls who were transitioning. It was very appealing to me. When I was 19, I went to a gender clinic in Boston, and they affirmed everything that I'd been feeling. After my second appointment at the gender clinic, they were able to start me on testosterone. After 1 year on testosterone, I had my double mastectomy. I just assumed that the top surgery went along with the transition. About 4 or 5 years into transition, I started to feel some serious abdominal pain, and I was just searching for a solution. When I went to the gender clinic, I did have a feeling that they would recommend a hysterectomy, and they did. During my hysterectomy, something went wrong, and they cut one of my arteries, and without realizing, they were letting me bleed out for hours. I realized how bad it was and how panicked my parents were. They were basically waiting for a phone call that said I didn't survive the surgery. That's when it really hit me what I had done. The dysphoria caused so much mental and emotional turmoil for me that I was completely clouded and I couldn't see things for what they really are. Now that I've been detransitioning for 2 years, I think I've recovered about as much as I ever will. My life is back on track. I'm engaged now. There will still be things that come up that are very painful. Now looking forward to marriage, my husband and I will not have children. And it's his kids, too, that we've lost from this. I had my top surgery, so a double mastectomy, when I was 20, and the hysterectomy, which included the removal of my uterus, cervix, fallopian tubes, and both ovaries when I was 24. I'd been a tomboy growing up, but at no point in my childhood did I think I could transition. I didn't realize that was an option until I was 18, and I discovered on YouTube and on social media that a lot of girls have gender dysphoria, and what they do to deal with it is to take testosterone and have surgeries. And from what I could see from all the social media posts was that made them feel happy again in their bodies. And I thought that those are the steps that I should take as well, because I just fit in the box of gender dysphoria. In response to being questioned about why her parents didn't have her go to therapy as a first step, she said, quote, "When I did come out as transgender when I was 18, I was already an adult, so that would have been on me. As far as the doctors she saw," she says, quote, "they told me that I actually did need a therapist to get hormones and surgeries, but because I didn't have one, they just made me meet with somebody in their office to be able to do that and sign off on everything. And that only took 2 appointments, I think, before I started on testosterone. And then when I was ready for the double mastectomy a year later, I just told them I was ready for it and they signed off on it. So I had the consultation with the surgeon and scheduled the surgery." The 2 therapy sessions she had were about an hour and 15 minutes combined. The first appointment, which was a half an hour, didn't even involve any therapy. They merely went over the health risks of taking testosterone. And at the second appointment, which was 45 minutes, they just took a history of mental health issues, how long she had been experiencing the dysphoria, and rubber-stamped the official diagnosis, gave her a prescription for testosterone, and signed off on approval for the surgery. All with absolutely no therapy. A minimum of 1 year of intensive therapy would have been the standard for someone her age, 19, in a more rational world, according to Dr. Phil. That time is necessary to explore all the underlying motivations and look for deeper issues that are the true source of these painful experiences. Quote, "Right away I noticed my voice deepening, and that gave me a lot of confidence. And I actually thought that that meant that the testosterone was the right answer and that it was curing my dysphoria. I didn't realize that anybody that takes testosterone is just naturally going to feel more confident." She wishes she could reverse the deepening of her voice now, but she doesn't think that will ever be possible, and it probably won't. The source of Katie's abdominal pain, which led to her hysterectomy, was uterine atrophy, which was pulling on the muscles of her abdomen. The gender clinic was not surprised by this side effect of the testosterone. The doctors didn't even know that they had cut an artery during the surgery, and so she was taken to recovery. But she continued to get worse and began to lose consciousness, which caused the nurses to order an ultrasound, where they saw that she had blood pooling in her abdomen from bleeding internally for hours. She was rushed back to emergency surgery and had to have 3 blood transfusions before she was eventually released from the hospital. Quote, "The turning point in my transition was just a normal haircut appointment. I was looking in the mirror and I just broke down crying because I could finally see myself as a woman for the first time in my adult life, and it felt like my eyes were just opened. And that whole cloud of dysphoria was just gone." Isabel Isla, who is suing alongside of Katie, was suicidal and told that going on testosterone would fix her. Doctors bullied her parents by telling them that if she didn't start testosterone right away, she would take her own life. And she walked out of the clinic with a prescription for testosterone that very day. She was 14 at the time and would later realize that her problems had nothing to do with gender. She began identifying as transgender at 12 when her dysphoria started. She was referred to the Hasbro Children's Hospital for a psychiatric stay after the initial psychiatric evaluation. The doctors there told her parents that they must affirm her or she would commit suicide. She had received testosterone on her first visit, which was only 45 minutes long. She now lives with chronic pain and fatigue as a result of the testosterone. She was diagnosed with hyperthyroidism while she was still on the testosterone, which has now advanced into Hashimoto's thyroiditis, which is a serious autoimmune disorder. Eventually, Isabel discovered that she didn't actually want to change genders. She was just running away from her own femininity. Quote, "It became clear to me around the time I was 17 or 18 that this was all for nothing. I was running away from the woman I could be, the girl I was. And it was really painful given all the experiences I could have had, the normal life I could have lived." The doctor in her case, Dr. Jason Rafferty, is so wrapped up in philosophical ideals rather than reality that he actually voluntarily told the Boston Globe in an interview that, quote, "treatment decisions are oriented around a child's sense of reality." A so-called expert believes that extreme, experimental medical treatment that is permanent and life-altering should be done based on a child's very subjective, their ever-changing, fluid grasp of reality. This is the type of doctor who promotes this. Someone just finishing their residency with no real-world experience. Someone who is more of a political theorist than a reputable physician. Because a physician's first rule is do no harm. Anyone who's ever been around children knows that one day they want to be Superman. The next day they want to be a cowboy. The next day they want to be a mermaid. And the next day they want to be an astronaut. And so on. They can't even decide what clothes they want to wear in the morning without changing their mind. But they're supposed to decide on what gender they want to be for the rest of their life? These wonderful little people believe in Santa Claus, for goodness sake. And if any children are listening, yes, Santa is real. And why are you listening to this? Seriously, where are your parents? They have no grasp of reality. Dr. Sapir summed up, the way that it's presented to patients in a clinical environment, usually by gender clinicians, is that this is just kind of all a la carte. If you want to do hormones, you do hormones. If you want to do surgeries, you can do surgeries. The reality is that once you put a child on puberty blockers, between 92 and 100% of them, according to decades of research, will go on to cross-sex hormones. Once on cross-sex hormones, in this case testosterone, that greatly increase the chance of the dysphoria becoming even worse and the patient wanting a top surgery, a double mastectomy. And there's also emerging evidence that testosterone also causes uterine pain and makes it more likely that the young woman or even adolescent girl will want a hysterectomy. So this is a cascading effect. Each stage of the intervention makes the next stage more likely. And from all these stories, it sounds like that's an accurate assessment. Quote, the Cass Review actually commissioned the first systematic review of evidence for social transition. That's the use of names and pronouns in children and adolescents. And what it found was that there is no credible evidence that social transition in children results in better mental health outcomes. However, there is some evidence that by socially transitioning a child, you lock in a state of temporary confusion or distress that's likely to persist and lead to medicalization. Hilary Cass called social transition, quote, an active intervention. That speaks to your point about teachers are not mental health clinicians. They're not qualified to make these types of interventions, especially without the supervision and consent of parents. And so essentially what is going on across American schools right now is that you have teachers, school counselors, school administrators performing potentially disastrous psychological interventions in children while keeping their parents in the dark about it. Dr. Heim added, quote, it's one of the most horrific complications in the world of surgery is you bring a young person in for a routine procedure and then they're bleeding afterwards. I've seen young people die from that. And to think that you could have passed away, and I'm so sorry that my profession failed you, truly. Katie admitted, quote, it's actually been really hard to be able to trust doctors after everything that's happened, but now knowing that there are people who will stand up, he interrupted, why would you trust a doctor? Why would you? Right. He continued, when they put you in a situation where you might have died. Personally, over the years, I wanted to be many things. There was a time when I wanted to be a princess. There was a time that I truly wanted to be a ballerina. I wanted to be a writer. I wanted to be an actor. I wanted to be a mother more than anything else. I'm giving it a go at being a writer, but out of all the other things, I'm none of those things. Not one. Whether these surgeries should be done at all is a topic for another day. The fringe extremists who want things 100% their way with no compromise, who don't care about the impact on others, can call me transphobic if they want to. I care more about kids than I do about them. I'm not stopping them from living their life however they want to. But as far as doing this to kids, especially based on nothing more than a few people's preferred ideology, I think the verdict is in. And since our next series is a breakdown of all the politicians in the upcoming election, I would remind everyone that Biden's changes to Title IX that supposedly protect trans students include a change saying that a boy that identifies as a girl must be allowed into the girls' locker rooms and bathrooms. There have been rapes that have resulted from policies like these in Virginia schools. Another change allows schools to give children, quote, gender-affirming resources without notifying their parents. So if your kid has gender dysphoria and is at about 10 times the risk for suicide, based off the stats, as he would normally be, the school is allowed to keep that information you would need in order to help them from you as the parent. There have been cases where a girl who was transitioning to a boy at school, without her parents' knowledge, was allowed to sleep in the same bed with a biological boy on a school trip because that was how she identified. Teachers that do object to these policies, that will not go along with encouraging impressionable children to go down this dangerous road, who believe that parents need to be involved in their child's life for their own protection and well-being, who believe that teachers aren't qualified to play therapist, are being fired. There are also 100 jurisdictions in the United States where parents are legally barred. They are outlawed from getting help for their children who are suffering from gender dysphoria from a counselor. unless it is a counselor who agrees to transition them. They cannot even see counselors who would explore other options to try to help them make peace with their biological sex first. Katie asked a good question, quote, "It seems like, why are they pushing it on our kids? Why can't they just leave it for the adults?" Because they genuinely believe that men can become women and vice versa. And with that belief, they see it as cruel to not transition minors as well. So, I ask everyone listening, can we please be sane? If a little boy wants to play with a doll, let him play with the doll. That doesn't mean you need to tell him he is a girl. And that certainly doesn't mean that you need to castrate him before he's even old enough to know what that means. Can we be sane, please? Enough ideology. It's time for sanity to be put back in charge. And if you would like to help Dr. Heim with his legal expenses, he has a fundraising page at GiveSendGo. Just go to givesendgo.com/Texas_whistleblower. One word. I thank you for sticking with me through this podcast. As I said in the beginning, I know it's going to be long, but I feel like it's a subject that you have to really take your time with to do justice to, and I don't make the choices about the stands I take lightly. I don't want to cause anyone harm. So I hope you understand where I'm coming from. And even if you disagree with me, which you have every right to do, I hope you can at least be unbiased enough to know that I'm coming at this from a place of wanting to do the right thing, as I'm sure you are. We need to get back to a place where we can disagree with each other without thinking that the other person is evil or motivated by a desire to harm others. Anyway, I appreciate you listening. I hope you will come back next week. Have a good week, my friends.